Hello everyone, I'm Kibin Alleyne and today is Tuesday, March 26th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In 2021, the CDC reported that 18% of new HIV diagnoses in the U.S. were among women, while men still accounted for the majority of new diagnoses with 79%. Following National Women and Girls HIV/AIDS Awareness Day, we will delve deeper into the effects of HIV and AIDS on women with Dr. Kerry Murphy, an infectious disease doctor at Montefiore Health System. Doctor, thank you so much for joining me.
Thank you so much for having me today.
Now, can you just give us a little bit more background on your role as an infectious disease doctor? And, can you just talk a little bit more about that and how it relates to HIV and AIDS?
Right, sure. So, the majority of what I do as an infectious disease doctor is really focused on HIV infection, and that could mean a lot of different things for different people. So for some, it's getting people tested. We know that 13% of people who are HIV positive are unaware of their diagnosis, according to the most recent CDC data. So the reason we want people to get tested is because we have available effective treatments for people, and so we want them to access care. But my role really is focused on basically being a primary care doctor for people living with HIV. So because we have such effective treatments, one-a-day pills that are, have very few side effects, if any, most of my patients are doing really, really well. So I'm a primary care doctor, which is really great. And I get to experience, all the things that come with that, meaning being involved in people's lives as they go through their first pregnancy or the birth of a grandchild or the development of a new chronic condition. So I am able to kind of really be that person for my patients, which is wonderful. This is a chronic condition that people are living long, healthy lives with. So being tested for HIV is really important because we have all these great effective treatments, and this doesn't need to be something that isn't treatable. It doesn't mean that we don't have effective treatments anymore. We do, and that's why we want people to come and get tested, and if they test positive, to come to us for care. But if they test negative, there are other conversations that we have in terms of prevention, which we can talk a little bit about if you'd like.
Now, I really want to, I mentioned that we're going to focus a little bit more on women. Can you just talk a little bit, about the unique challenges that face women in regard to HIV and AIDS?
Yes. Women, wear a lot of different hats, right? So we juggle our own lives and our own health, but maybe we're moms or we're daughters and we're caring for aging parents, or we have, busy careers and all of the sort of demands that come into play. So I think, that is one of the barriers for women, is sort of taking care of themselves and getting, that access to care and coming for their appointments. There are some unique stages of life for women, right? So we have children. So pregnancy is a very high risk period for HIV, breastfeeding period as well. So those are unique times where women have maybe more access to the healthcare system with prenatal care. Those are opportunities for some people the first time they're tested for HIV. But during the pregnancy period, there may be, other high-risk times, and so it's important to have conversations with your doctors about, getting that HIV test, but also to learn about prevention methods. So we have now what's called PrEP, which is pre-exposure prophylaxis, which are, two different options available to women that they may not be aware of to help prevent HIV. One is a pill that's taken daily. It's tenofovir emtricitabine, or Truvada, which people may know it as. It's a once-a-day pill. The other is an injectable medicine that's given every 2 months. It's called cabotegravir, and those are both available and effective and safe for women, but they may not be aware of those options. So during pregnancy, that's very critical, but during the entire lifespan, that's also very important. And I bring up the pregnancy piece because obviously there's a baby involved too. So taking medicine or preventing HIV not only protects mom, but also protects baby. So that's, one of the great things about being able to offer these treatments and preventive treatments.
Now, what are some prevalent misconceptions about HIV today, and how might these impact women seeking treatment?
I think the big thing is that this is now a chronic treatable medical condition, right? It's like anything else. Hypertension, we have treatments. Diabetes, we have treatments. This is, an infection that anybody can get. If you've ever been sexually active in your life, you're at risk for HIV. It's not something that, anyone should judge you for. Like I said, it's sort of, there was a lot of stigma and still is a lot of stigma surrounding HIV diagnoses, but this is now a chronic treatable medical condition that, people can live long, healthy lives with. And so we really want people to, be comfortable asking for HIV testing, be comfortable discussing prevention methods, and if they test positive, to come and know that there's effective patient-centered care and available treatments to them. So I think the one of the big things is that this is sort of certain people are at risk, but everyone's at risk, right? So that's, I think, a big misconception.
Now, what systemic changes are needed, if any, to support individuals, especially women, living with HIV and AIDS?
Well, I think in New York we have a really nice model of care delivery. Like at Montefiore and other places in the city, we have sort of comprehensive care services. And so I think that model really, and there are other parts of the country, but to really kind of roll out that model a little bit more systematically would be great, because for our patients, we have once-a-day pills, they're well tolerated, they work really well. It's not that necessarily, it's the other things that sort of impact access to care. So everybody's different. Some people it's, struggling with insurance coverage and they need a social worker to help them. For some people it's mental health challenges. For other people it's a substance use disorder or unstable housing. Like, all of those things need to be addressed in order to help people access care, stay on treatment, and live long, healthy lives, right? So we have sort of in our clinic model, it's on-site pharmacy, on-site social work, on-site mental health services, and your doctor, right? All there together, so that it's sort of easy and we can address the barriers, and therefore it's easier to take your medicine every day. So I think that is a big challenge. The other one is really women, as you mentioned, are 20 to 25% of new HIV diagnoses, and we need to include women in research and in all of these drug therapy trials and all the cure trials. Like, women need to be represented, and people that are not necessarily in these studies. Like, it doesn't help us if only one group of people is enrolled in these research studies, right? So we need to be able to apply the results of these studies to women and other groups.
Now, you mentioned, just working with people in general, and how there's often these misconceptions. What can we do to facilitate open conversations about HIV and AIDS, and why is it important to encourage this dialogue, to include both males and females, and, just anybody from any gender?
Yeah. I think just starting those conversations is really the first step, right? So there are lots of studies and research showing that, like, doctors and the things they bring up with their patients can have a really profound impact. So that doesn't mean that, any particular group is, necessarily the one that should be targeted for these conversations. It's everybody across the board. And so just, making that part of, like, routine care. Have you had your HIV test? When I go see patients in the hospital, when I'm taking care of, they may be coming in for something completely unrelated, and I use that as an opportunity to, like, offer that test. It's healthcare maintenance, right? It's like your colonoscopy and your mammogram. It's an HIV test because we have all these great treatments. So, sort of just making it part of the conversation. This is not something we're testing for that we can't offer treatment for. So I think, really just having open conversations about sexual health, about drug use, about all the things that sort of put people at risk, because we, have treatments and, that we can offer for all of those things. And so that all helps reduce risk as well.
And what do you think we can do on societal level to destigmatize HIV and AIDS? So just, maybe a friend to another friend, or, speaking with a family member. I know it's an uncomfortable conversation to have just in general, but what can we all do on that level to destigmatize HIV and AIDS? Right.
So I think awareness is really important. And like I had mentioned, I think there's a large percentage of women that don't know that there are preventive treatments available, for example, right? So, we have our girl groups, and we have our extended network of women, being comfortable talking about, hey, I had this visit with my doctor, and did you know that there are these, like, preventive treatments that are available to women as well, right? It's not just for men; it's available to women, and just making it part of the conversation so it's not a big deal. It's just, this is something that I learned from my gynecologist. Like, I'm having a baby, and there are these preventive treatments that you can take during pregnancy to protect you and also protect your baby, so that it's not a big deal. It's sort of more about like my health. What are my options available to me?
Now, what advice or support would you give to a woman who is living with HIV and AIDS, whether it's a new diagnosis or something that, they have possibly have been living with for some time?
Yeah. The first thing that I always start with is, you're going to be okay. Like, we have really good treatments for you. This is something that we know we can treat well, and we need to work with you to figure out what are the barriers to getting you on effective treatment. So asking what the questions are, asking what the barriers are. It's different for everybody, right? So maybe somebody can't swallow pills. Maybe they would do better with an injectable medicine. So there are a lot of things out there, but if you don't kind of query the patient where they are, you won't know what those things are. So it's not that we don't have the treatments, as I said before. It's really more of like, what are the things in the way, and how do we address those?
And we have about a minute left. Can you just quickly, as somebody who's been working in this field, what do you hope to see for the future of just, healthcare and HIV and AIDS?
Yeah, I think, women are a key population, and, we're the ones that bring women and babies into the world. And so I think, really focusing on prevention, testing, treatment at all stages of life is really critical, and making this sort of an open conversation is really important. I think that women need to, as I mentioned before, be the focus of a lot of our research efforts as well. They need to be included in studies at different stages of life, right? During pregnancy, during breastfeeding, and to really just sort of bring them into the conversation and empower them to have these conversations with their doctors.
Well, Doctor, I want to thank you so much for joining us and having this really important conversation.
Thank you for having me.
To learn more about HIV and AIDS treatment and support from Montefiore, please go to their website at www.montefiore.org. Don't go away, we'll be back with more Open after this.